up all of us. That's the good thing. It is good to have you here.
Thank you, Natalie.
Admit this or not, most of us, you know, we have fretted over the lines, the wrinkles that come. We'll worry no more. We have Dr. Cynthia Henry here from Apex Skin. She's here to help us. And I feel like what we're talking about today is something that in the past has had kind of like a negative stigma. We're talking about things like Botox and fillers. Now it has almost become the norm, I feel like.
It is. It is mainstream now. Absolutely. Yeah, we've been doing this for almost a couple decades now. It's good for everyone who wants to look younger, more youthful, and have just a rejuvenated look.
So why don't we, I know there are two different things here. Do you want to start with, we'll just specifically talk about Botox, what it can do, how it can help people, and maybe even how young people start to do this? Because I feel like people are starting it younger and younger to prevent things from getting worse.
Absolutely. Yeah. Before it was probably used for older ages, but now even people in their 20s are asking me, how do I prevent wrinkles? And it really is something that can work with that too. So you've got, with Botox, you have small injections, and those injections help relax the muscles that make lines. Most commonly, and the most popular place to have this done is between the eyebrows. It relaxes the muscles there for about 3 months. It's a very natural look. You can see on the picture there, the glabella is what we call that area between the eyebrows.
Sure, and then helps with the forehead lines, the crow's feet on the sides.
Yes.
And then around your smile lines too, correct?
It can be used there too, yeah. Most patients start with using Botox on the upper face, so around the forehead area, the glabella, and the what we call the crow's feet. It can also be used on the lower face also.
It's interesting when some of these I didn't understand. Your nasal contouring, so it can also help with contouring.
You can relax muscles so that you can actually make what would be more of a chemical nose job. Yeah.
Interesting. And then I'm just like, look, the gummy smile. What is that?
Yes. That's where when people smile real big and they have more of their gum on the upper top area, and you can relax those muscles so that there's less of the gum line and more teeth. Yeah, just the teeth.
I didn't know some. I mean, some of them look very familiar. Others I'm shocked by. So if we're talking about, when it comes to Botox, it's relaxing the lines. It's not filling. So fillers are what you then go in with too if someone has really deep creases.
Fillers, think about them as being able to increase volume. So as we age, unfortunately, we lose some of the volume of the face, and that leads to creases or lines in the face. So by putting the volumizing filler substances, like hyaluronic acid is a very popular one, you can bring the creases up or fill them or increase volume so that they're less noticeable.
So what are some of the common areas where people use their fillers then?
The fillers are used, we think about the fillers being used on the lower face, around the mouth, what we call the nasolabial folds or the sides.
So when you get those big smile lines there?
Yes, those lines, it works wonderfully for that. It also works into the chin and what we call the marionette lines right underneath the lips. Also to enhance the lips, either more definition to the lips or even adding volume to the lips.
So I think a lot of people, they hear about these things then and they get really excited to think about it. But then I think probably a lot of people question the safety of it. Is it safe to be putting these things in my body? This has clearly been something that's been going on for quite some time.
Yes, yeah, they both fillers that I was speaking of, the hyaluronic acid ones, and Botox have been FDA approved for the treatment for cosmetic purposes. They're very safe. Of course, there are some side effects. Some bruising can be something that can happen with treatments, usually very easily covered with makeup though. And with the fillers, there can be some swelling after treatments also that you have to take into account. So
would you say if someone isn't anxious about going under the knife, you can really make subtle improvements with doing things like this?
Absolutely. Yeah, this is, we would call it more of a non-invasive way to facial rejuvenate.
There's a lot of new things out there. I'm telling you, I'm sure there's a lot of new trends that you also have that people can come and experience. They just set up an appointment with you, correct?
That's right. Yeah, we do consultations for all of our patients to make sure that we're meeting their goals and expectations for all of our treatments that we do.
So give them a call. It's not just about Botox fillers. They do a wide variety of things there. And I thank you so much for being in here and always educating us on proper ways to really take care of ourselves and rejuvenate our look, right? Thank you.
Thank you, Natalie. I appreciate it.
You're very welcome.